Physicians for Human Rights works to document the health consequences of sexual violence in armed conflict, and also to help gather forensic evidence so that these cases can be brought to justice nationally or locally as well as internationally. So we're very interested also in supporting the work of the International Criminal Court to prosecute mass rape at the highest levels in terms of going after the leading perpetrators, especially in countries where there isn't the will or the capability of prosecuting these cases. But our work is really centered first and foremost around the survivors of sexual violence and their needs. So we think about justice in a holistic way. We're very as much concerned about the needs of the women, their physical needs, their mental health needs, their economic needs as part of justice as much as we are about prosecution, which is also critical. Recently, a medical colleague of ours at Physicians for Human Rights and I went to the Democratic Republic of the Congo and Kenya to assess the challenges and obstacles to achieving justice or to ending impunity for rape that has occurred in both countries around conflict situations, in Kenya after the post-election violence, and in the DRC in the ongoing conflicts in eastern Congo. And we met with doctors and nurses and counselors trying to understand their challenges in their needs and training to how do you gather evidence when women come many months after a rape. There are many ways that health professionals can gather better evidence, and we'd like to support them in doing that. And then how doctors and lawyers must work together so that the doctors understand what the legal process is like and how to appear in court, and lawyers can understand from doctors and nurses what are the limits of what they can produce as evidence, and then how to actually work together to bring it together with police. And of course, police in many of these situations are sometimes even the perpetrators, or they're defending their governments. And so we need to bring police more to understand that it is their role to serve the victims, no matter who the perpetrators are, even if the perpetrators are from within their own ranks. And that's very challenging too.